Hold on. Okay, so go ahead and flex your knee. So this patient right now, when she flexes her knee, she has patellar pain, probably around the stomach 36 area. And what we're going to do, we're going to put needles in and then have her flex her knee again to see if she has the... Hold on. Okay.
Turning my shoes. My shoes.
Okay, so for the first point we're going to do 66-02 and 03, Hoju and Hoji, because we're going to do that on the same side of her pain. That was a good one. And then we're going to do the pericardium, the PC6, on the other side. There we go. Let me see your arm. And then what we'll do is we'll have the patient there's one. So we may be curious as to why these work. The pericardium and the liver will both fix the liver will fix the same side, and the pericardium will fix the stomach, and the pericardium and the liver will also communicate with each other and increase circulation. And so now if we have the patient move your right knee, go ahead and flex your knee, Edie, and we're having her flex your knee on the table. And now how does that feel at the patellar joint? That should be a lot better. Yeah, see, it doesn't click anymore. Yeah, so there we go, we fixed that problem. So 2 needles in the foot on the same side of the liver, and then on the opposite side we've done the pericardium. And also some of you may be noticing, here is the first point, here's the second point. Again, the 2 needles, 1 + 1 = 3. And also if you look here, the knee can be imaged. Obviously the elbow is the knee is also the shoulder. And then if we go down to a quarter image, the knee is also here on the mid-forearm, and that's another reason why if we needle here in the mid-forearm, even though it looks like the mid-forearm, there's an image there of the knee, and that's why that will treat this area.
Turning my shoes.
I think we're recording. Okay, so we're recording. So today we are treating our patient again for knee pain, and we've already done a few different points on her wrist. We've done some points on her shoulders, and today I will show you the knee pain at her elbow. Let me get a different needle here. If we can get the needle out. Okay. So basically, since the elbow will be the needle, we'll insert the first one at LI11, like such. And then to get a really good spot is to get the Shengguan area, the spleen 9 area, is right here, kind of between lung 5 and LI10, LI11, and we have to make sure we tap her radius. And actually it's a bit more, it's right there. There's her radius right there. And then we tap that, and then we can add in large intestine 12. Again, we'll be tapping the bone. Good. And then we'll add in heart gate, about 1.5 soon down. There we go, from SI8. And what we're doing here, so we have the small intestine, the large intestine, and kind of the lung, and that should cover all the channels and all the little bony protuberances down in her left knee. And so if she moves that, move your left knee now, how does that feel? Should be a lot better. Do you feel any pain at all? Okay.
No, I don't.
Okay, so all the pain's gone. The only thing I'm adding in here, this obviously isn't a dome point, but it is between both joints, or between both the radius and the ulna. And by putting the needle between that, that will help down there around GB 34 and stomach 36 area. But I bet if she moves her right knee, she might be better. But how's your right knee feel? I bet that still hurts.
Not really.
Yeah, should be better. Yeah. So, and what we can do, I can show you guys really quick too. It'll be very simple. We can just over here. Again, we can image the knee on the hand, and what we can do, even though double saint and double child is on the other side here, okay, that's going to help knee pain, but
we can get it from the top. I can insert a needle, there we go, to get the double saint, double child, like that. That was pretty intense actually for her, but that's okay. And that should, there we go, that's a good one. So you can see I've done the double saint, double child basically from the top of the hand down to the plantar surface, which sometimes can be easier for the patient. Those are pretty intense. But now if I have her move her left knee, her right knee, it should be like 100% better. Yeah, so she feels great. So basically I'm just showing you guys that we can do elbow points for the knee, and that fixes it. We can also do hand points for the knee, and that's fixing both of them. So